Welcome to KGTV. Today we are in the studio. Welcome, Dr. Judy.
Thank you so much.
Yeah, what's new today?
Everything is so new.
Mm-hmm.
So today I really want to talk about things that we don't address. Sexless marriages. Because I've had a lot of questions, and as a man, I want you to just shed some light on why we have so many issues with that.
I want to give a disclaimer that this topic is very sensitive, and many people don't talk about it.
Okay.
So I was wondering why you came up with it. So you have to know that it's a very controversial topic. But being in the press, I have to answer because I say I can answer any question. So let's start first. What is a sexless marriage? According to the Social Organization of Sexuality, they define sexless marriage is when couples aren't engaging in sexual activity or are having minimal sexual encounter. That is what we can call sexless marriage.
Okay.
Either there is no sexual activity in the marriage, or it's very minimal.
Okay.
But the jargon there remains, which is minimal. That is what experts have not explained what we call. Some say maybe few once a month or whatever. But that is actually what divine with the sexless marriage.
Okay. You know, I mean, great answer. The reason I asked you this is because we've had so much happen, you know, in terms of COVID and, you know, just people being absent, people working doubles, because, you know, we're in a world of absenteeism.
Yeah.
And I want you to delve into what do you think are some of the causes of sexless marriages with African men?
Okay. I can say that is a very big topic, and there are different answers. Every situation is different. But one thing I would have to say, let us look at how people come together in love. According to the triangular theory of love, there are three components of a triangular theory of love. These the basic things of love which makes a marriage, and that's what I want to delve in. And I want you to. We have three components. Intimacy, in which makes a triangle. Intimacy, passion, and commitment. These are the two basic things which make a triangle of love that when it is combined together. And when it is combined together, you can see on that triangle, we have passion, intimacy, and commitment. So basically, when these two are together, they make it a complete. Some people can have passion, like somebody, like love at first sight, moment. Somebody could have somebody. Then we have intimacy, which starts as a friendship, liking. People can like a person. Commitment is when you say now you want to stay together, and that is when you take the marriage vows. So at different people, when they get married, many marriages, they come in all different forms. There are some people, you know, a man can say, oh, I love that woman. Then they start from there. Sometimes they will start as friends. Some marriages have only commitment, which is empty love. Have you ever heard about arranged marriages?
I've heard about arranged marriages, and you know, I love your analogy and everything that you talk about in terms of you know.
So basically, what I wanted to say about this love, some people can marry when they only have passion, and when that passion becomes familiar, it dies.
Okay, so here, I'm going to interrupt you real quick. So, infatuation
Okay.
is the same thing as...
Yeah, infatuation, yeah. Infatuation is passion.
Yes.
Like, have you ever seen somebody say, well, I don't know about ladies, whether you ever, do you have, I don't know whether ladies admire men, but the men always
do, by the way. You know what, when we watch football, for example, you know, we see the muscle, the way playing.
Okay.
Yeah.
Okay. You might only pick that you see the way he's playing football, and then you get infatuated with him. So you will marry this person, but may not necessarily turn out to be your friend. You might have liked this person because he was a star, but when you get married to this person, you get committed. You are one of the cases which will maybe end up in the future to be a sexless marriage.
So some of the issues or the questions that I've had from men are, you know, sometimes when women get married, you know, the infatuation part, or you know, you get married, a woman looks so amazing, and all of a sudden she starts wearing a stocking on her head when she goes to bed. Then she's wearing a t-shirt, breasts hanging, you know, the makeup is gone. So would you classify that as part of their passion initially, and then everything dies?
That is, wearing a stocking to bed and not grooming yourself are the symptoms of a failed marriage. They are not the cause.
So they are symptoms.
Those are the symptoms that things are not working well. Let me tell you, you have to keep the fire burning. You have always to be the best for your spouse. The way he admired you from out there, you need to come. Don't say that now because you have reached home, you have conquered, now you will start wearing t-shirts without a bra. This man always stays with people who are well dressed. Then he comes home and finds you don't have that.
Would you buy a bra for a woman who's struggling, or, you know, would you advise spouses who are struggling out there that, you know what, go out there and size them up, get them a bra?
Well, if you don't afford, but I don't think if bras are expensive, so you can. So that is what I call wear and tear.
Okay.
Wear and tear comes where, like, when you see somebody putting a stocking, not dressing well, maybe he has given up. Maybe the marriage is not working. Love, you know, love can be born and the love can die too.
Okay.
But you have to keep the candle burning remember the triangle I showed you? To have, for a perfect marriage, it is whereby all of the three loves are combined together, and they form what we call consummate love.
Okay.
At times, if you are married, you liked the person.
Okay.
And you are the passion.
Okay.
Then when you have commitment, that is completely consummate marriage. But some people get married, as I said, if you are arranged for marriage. Not even arranged. Do you know there are some people who want to marry because maybe the age has caught up with them? Then they take anybody they get.
Okay.
But they go try, liking never come in, intimacy does not connect. There is always a disconnect.
So would you equate a disconnect to erectile dysfunction, or just, you know, having sex so that people...
No, that's a different factor.
Okay.
Another factor which causes...
would it be maybe a low sex drive for some of these people, if they are not, if they don't have the passion, you think?
I can say that cannot be, it could be, but one other factor which causes sexless marriage is when there is a condition we call it sexual desire discrepancy.
Okay.
STD. It's called STD. Sexual desire discrepancy.
You know, okay, so I'm going to interrupt you. So, because STDs, you know, sometimes in medical terms, an STD is a sexually transmitted disease. So,
No. I said SDD, not STD.
Oh, wow.
SDD, sexual desire discrepancy.
Awesome.
This is where one partner has more sexual drive than the other.
So, hypersexuality.
Hypersexuality and hyposexuality.
Okay.
So when one has lower libido and the other one has higher libido, so the other one with the higher libido will always want to have more sex frequently.
What is a libido?
Well, yeah, you are a doctor. You shouldn't be asking.
No. We need to explain this to the
well,
general public.
That's a common term. Maybe we need more medical terminology. We don't want to say, but as we say, it's another term for sexual desire. Okay. So when it's different like that, like now they found there was a study which was done in 2015 about sexuality. They found that 80% of the marriages have that sexual desire discrepancy, whereby one spouse has higher sexual desires than the other one, and that can cause a problem too. Then is a factor.
And you know, I not to make you uncomfortable, but I just want to explain to the public or whoever is watching that yes, hypersexuality and hyposexuality actually are diagnoses that we recognize.
That's very true. And another reason which causes that is mental illness. Mental illness, when people are depressed, you know, marriages, there are so many depression which comes out of marriages. When people are not agreeing, they are arguing, even when there's domestic violence, now there is tension in the family, it can cause depression.
Yes.
Which also, if somebody has mental health,
yes, they have mental health.
Like he has mental issues, then sexual desire goes away. And also, most of the medication they use, like for treating them, like now serotonin reuptake inhibitors.
SSRIs.
SSR.
Yeah, SSRIs. And you know what? I can talk about that. I mean, a lot of these medications, you know, I mean, they will depress the sexual desire.
Yeah. And
they will even cause, you know, hypersexuality. And some men will not take those medications for reasons. So, yes, you know, we know, like citalopram, for example, Sexless. You know, some men will say, you know what, don't put me on that medication because some of the side effects of those medications are actually sexual hyperfunction. So we know that they depress a certain part of their brain.
Yeah.
That.
Exactly. You know that for somebody to have a sexual desire, there must be a release of some chemicals like dopamine.
Of course.
And acetylcholine. So they are inhibited when you use these medications. When they inhibit the production of those chemicals, then it will make even somebody who was sexually active to not being active, and it can result into.
And you know what? I mean, I like the fact that you talk about that because at the end of the day, that's why some people don't want to talk about or they don't want to take these medications because yes, you know, dopamine, serotonin, you know, those are major in our bodies. Like, you know what? They will control our sleep. They will control excitement.
Yeah.
You know, so if I'm going to give you a medication to suppress that, I mean, can you imagine how depressing some men would be? Be like, you know what, no. And that's why even with our weight gain.
Yeah, you know, those are some of the things. And actually, basically, lifestyle, there are some things we put into ourselves. people work so hard. When somebody works 16 hours and then you come home, you are physically exhausted. And sex requires a lot of energy.
Yeah.
For if you have now here one spouse was not working, you have been working all along that time, so you can see a discrepancy. There are some discrepancies we create in ourselves because we work so hard, and then when a person comes from work, he doesn't have the energy at all. This person would need to take time, rest, the body to recharge, and have the energy. So also that the lifestyles, people work hard, people go to meetings and they are doing business here and there, then they don't have much time for themselves.
Yeah.
That can cause bring a sexless marriage.
You know, I agree with you. So I want to ask you a few questions though on that note. So do you think, you know, when people stop taking care of themselves, like, you know, if they were brushing their teeth or using deodorant, you know, trying to look cute, do you think that affects the sexual
I talked about it when I talked about wear and tear. Sometimes a marriage grows and it reaches a plateau.
Okay.
And the thing is, when you stop being attractive to your partner, the partner will lose interest in you. And once that goes down, then he's not seeing the girl he was excited, the girl he married from the road. He's not the man he admired. Now the man he admired is not grooming himself. He's not. I mean, I can see personal grooming. I don't want to be particular on other things. The things you don't want to feel in other people. If you don't want to feel people smelling, then don't do it to another person.
Do you remember Kenya bus in Nairobi? I saw here when
I know somebody would just.
Okay, so
personal grooming is very important.
Yes.
For sure. That one, even for healthy purpose.
Yes, very.
Yeah, you need. It is always good when somebody leaves home, dress well, put a deodorant, you know, put some.
Put some nice smelling.
Yeah.
So
things like that.
Tell me about Viagra.
What else Viagra? Oh no, that is another topic. But people resort to that when they have some abnormal condition. But for sure, I don't think it's. You know, Viagra was made for older people. But there are some people who have some dysfunction, sexual dysfunction, that they cannot have an erection, or they cannot produce like the hormones we are saying, the chemicals in the brain which will activate somebody to have that. But the problem is that we are seeing very young men using it. And when you become dependent in using it, and it has some side effects, and it does not mean that it's even making you any better, I would totally discourage people from using it.
And the reason I ask is, you know, as a provider, you know, sometimes when people ask me about these things, you know, I want to be able to hear that from somebody who's, like, who hears it. Like, why are people actually asking about this drug? So, subject for another day.
Yeah.
All right. Yeah, so, what else?
So, basically, another cause is when people have poor communication. They need to say, you know, we come from a patriarchal society where, more especially ladies, they don't want to talk about it. They just want to be receivers, and they don't want to
What do you mean
participate.
receivers?
Because
of what?
people think, like I would want to say, to avoid from one of the causes of sexless marriages is like people don't talk. Some like most of the ladies,
Mm.
they will not, they can resort not to have sex because they think they are not benefiting from it. Either they are not getting it the way they want, so they resort into putting the sleeping alone. Why? It is because they don't want to sit and tell the husband, hey, I don't think you are satisfying me.
Okay.
Because they feel they will look loose, they will be looked upon because of culture. But it is always good for a couple to maintain communication. If somebody is not happy, go say, I don't like the way you are doing it. You need to do it. Like, this is my desire. This is what I want you to do.
Okay. So, in terms of satisfaction, do you think women like maybe just want to have babies and just pretend that they're enjoying
Mm.
the sex action, or what?
What I can say,
Mm.
we are victims of culture and history too.
Okay.
Many people grew up from cultures which was strictly sex was for childbearing only.
Okay.
And after a woman has gotten children, uh, then the business of the sex needs to end.
Okay.
You don't. If you appear to be well sex for what, and you have gotten children,
Okay.
that is the wrong concept. Sex needs to be enjoyed. Actually, it has been found that people who enjoy sex for a long time, they stay healthy for a long time.
So there's so much that we need to discuss with this, but you know what? There's also female sexual mutilation, and some of us was done so that women could not enjoy the sexual act. So something to talk about along those lines of culture.
Yeah, I think that was an abuse. That was, and I like the way they use it, female genital mutilation.
Yes.
That one was, I don't know who brought it. For sure, that is, if I were you women, you need to go to court and file a lawsuit for
For that.
culture. That was damage, but I'm happy it has ended. These days is not there. So
One thing I'd say is, I think we need to open this up. We are women of today, and hey.
yeah. And how did you come up with this topic? Because you must be very brave. People don't like talking about these things, and probably they fear it carries a stigma. But thank you for being brave to talk about.
No. I tell you what, man. I lost my dad when I was 13. I am a provider. I have seen so much. I see a lot of female patients, and I am that girl who's gonna stand up for what people don't stand up for. And on that note, hey,
Okay.
for girls, there. You know what? We'll have gifts.
Okay.
Yeah, coming up.
Thank you very much.
Yeah.
Did you have any other question? Or are we in there?
Do you have any other questions?
Well, not for now. I hope I answered your questions.